Good morning. Thanks for joining us for a back to school media availability. We have with us today Dr. Jennifer Vines, who is the health officer for Multnomah County. We have Jessica Guernsey, who is the public health director for Multnomah County. And we have Jamie Smith, who is a nursing administrator overseeing more than 80 nurses and 90 school health assistants for the Multnomah Education Service District. So we're really grateful for Jamie, who is both a nurse and a public health expert, to be able, and a senior manager, to be able to be with us today to answer your questions. We're going to ask Dr. Vines to start, and then Jessica and Jamie to make a few remarks. Then we're going to open it up for questions. And as we have done in these before, we would ask that you please put your name in the chat as the remarks start winding down. We'll call by chat and we'll get to everybody. So with that, I am going to stop recording, ask everybody who is not speaking to kill their video and come back on when it's your turn, and we will get started with Dr. Vines. Thanks so much.
Great, thank you, Julie. Thanks to the Multnomah County Communications team, and good morning, everyone. Thank you for being here. I'm Dr. Jennifer Vines. I'm the Multnomah County Health Officer. I just want to start by a high-level framing and acknowledge that since COVID arrived, we've been focused on avoiding hospital overwhelm, which we called flattening the curve. And really since last spring, we've been committed to getting all kids back to in-person learning. Right now, we have the highest level of COVID activity yet in our region, and we have our hospitals stretching deep into their surge plans. The Delta variant has exploded because it is so contagious. It moves quickly and easily from one nose or mouth to another. It finds its way very quickly to unvaccinated individuals, and many think now that it causes more severe disease. For those who are fully vaccinated, you are still well protected from severe disease, but the Delta variant is also pretty good at getting past our body's first lines of defense that we get from vaccination and can cause infection in the nose and throat. Finally, in terms of context, the level of travel and social mixing over the summer has been enormous, understandable and enormous. So we are at a unique moment in this pandemic. The risk of COVID in schools is a reflection of the amount of COVID in the community. With many kids physically returning to school tomorrow and next week, and with Labor Day weekend just ahead of us, we can all do our part immediately and in the weeks ahead by being mindful of how we socialize. Right now, Multnomah County recommends not gathering with people outside of your household for Labor Day this year. Postponing your event or going virtual is ideal. Otherwise, having a small group outdoors and spread out is the next best thing. If you must be indoors, please wear a mask and open windows. And as always, stay home if you have any symptoms of illness, even if you're vaccinated. I'm going to turn remarks over now to Jessica Guernsey, Director of our Public Health Division.
Morning, everybody. Can you hear me okay? I'll take that as a yes. Yes, my name is Jessica Guernsey. I'm the Public Health Director at Multnomah County, and really appreciate, want to send appreciations to the County Communications Office and my colleagues on the call and those of you covering this important moment. As Dr. Vines said, we're at a real pivot point in this pandemic that we have not been at before. While we have had schools return to some in-classroom activity, in terms of volume and numbers of children going back to school, we're at a pivot point. And myself as a parent, a community member and a public health professional, I am very confident in the work we've been doing directly with the school districts, private schools, public health, and the Multnomah Education Service District. I'm going to talk a little bit about some of the work that we've done. So if any of you watched the briefing this morning, you probably noticed repeatedly we talked about the importance of a complete vaccination series and masking. Those are two of our most important tools that we can use in the public health realm right now, particularly as schools are reconvening. And as Dr. Vines said, school transmission is a reflection of community transmission. So each of us has a really important part to play right now in protecting kids and making sure they can stay in the classroom. So right now, we're seeing about 67% of county residents has received at least one dose of the vaccination, and we're continuing to work diligently on bringing those numbers up. In addition to our vaccination work, like I said, people can do things that are going to reduce their risk personally, and if you have a child that is going back to school. So really the way we think of it is looking at our lessons learned over the last 17 months. Again, getting vaccinated, wearing masks, and really limiting other activities outside of school, particularly if you have a child in school. So we're just trying to give as much straight guidance as we can to parents. And as I said, I'm a parent myself, and I understand that this is challenging, but really asking folks to make sure that everyone in a household that is eligible for a vaccination gets one, limiting household social activities outside of school. Obviously, outdoor play is much less risky. Making sure your kids have masks and that they know how to wear them and that they provide strong coverage and good fit. In addition to that, as I mentioned, we've worked with the school districts and Multnomah Education Service District and private schools to develop additional guidances to really hone in on the activities that are going to be, pretty difficult to deal with in terms of the volume of kids that are coming back to school. So some examples of that are lunchtime and athletic activities. So we have been working to provide additional guidance at a local level to make sure we're going even further to help folks protect each other. So that's just a small overview of some of the things that we've been doing, and we can definitely delve into some more of that with questions. But I want to turn it over to Jamie Smith from Multnomah Education Service District to talk about our partnerships specifically around contact tracing and case investigation. MESD is one of our strongest public health partners. And like I said, I am so grateful and confident in this relationship that we've established over many years, but particularly in COVID, as it applies to reconvening schools. So Jamie, I will turn it over to you.
Thanks, Jessica. Hello, everybody. Jamie Smith, School Health Services Court Administrator at Multnomah ESD. So we work hand in hand with the County Public Health to increase safety by responding to COVID cases on site at all public schools in Multnomah County. As part of this process, all cases or close contacts among students or staff are reported by the schools to MESD through our process. And then we work based on guidance from the LPHA, Multnomah County, and ODE to provide that direction back to students, families, and school staff around isolation or quarantine timelines. Also, when there is potential exposures on site, we are working hand in hand with the health department to deliver that information and facilitate communication and notifications to families, students, and staff as well. We are grateful, and as Jessica said, we have had a longstanding partnership and certainly have appreciated the opportunity to renew that partnership during the pandemic. And continue to appreciate the collaboration that we have. And I also just want to highlight that it really takes all the school administrators and school staff, as well as our school nurses out there in the field, to really kind of be our boots on the ground when we are asking the questions about exposures, about close contacts on site, whether that be in a school setting, on an athletic field. We really need that partnership and that reliable information from those school administrators and staff and our nurses out there to be able to provide the timely and accurate response and direction for what the next steps are when those events happen. So thanks for having me.
Thanks so much, Jamie. I'm going to ask all of our guests here to put their videos on, and then we're going to ask reporters to put your name in the chat. I'll call on you, and looks like Lisa Balick has a question, and if you can unmute yourself, go ahead and ask yourself. Otherwise, we'll read it from the chat. Go ahead, please, Lisa.
Yes, good morning. A couple of questions, a couple of big issues that have already come up at schools and school districts that have already started school. The two issues being lunch and the desks being so close to each other. There's a state guidance says they recommend 3 feet apart, but there's no rule that says they have to be 3 feet apart. So question, I guess, two questions. One, what do parents, kids do about the desks when they're so close the kids are not comfortable, but the teachers say, well, we don't have other rooms, we don't have any other place to put kids, so that's why the desks are so close. Obviously, they're wearing masks, but when kids are not comfortable. And also, what's the plan for lunch spacing within the Portland area?
I can start with some of the lunch questions and move backwards. As I was saying at the briefing this morning, if folks are watching, lunch is probably one of the most challenging times for schools. I'm happy to report that many schools are considering multiple creative options, including taking lunch outside. I've talked to many schools and districts that are able to establish consistent 6 feet apart sort of in their planning mode. And then this week, as they go into operations, they're going to be seeing where are the glitches, right? So we obviously don't know where all the glitches are until we're fully in full swing with kids in school. So people are being extremely creative around the lunchtime, which I would say poses some of the biggest challenges. And I just want to make room for Jamie and Jen to jump in as well.
Yeah, I would just echo the educational innovation. We give them the information from the public health perspective, and then we really have depended on the educators to think through some of those. And so, yeah, some of the things that I've heard about, like Jessica was saying, outdoor lunch, trying to utilize other spaces, maybe the library, to increase the amount of square footage available for students to eat lunch, and then therefore allows for additional space in between. Changing their schedules potentially to accommodate more lunch periods, to again minimize the number of students that are in the lunchroom at one time. And then in terms of the classroom, again, we're just giving them the information that we have, and really depending on them to think about what works in their classrooms. And what it comes down to is that if there is a positive student or individual in that classroom, we will do our best to minimize the number of students that are quarantined by looking at seating charts, talking to school staff, and trying to determine truly those that are within close contact based on the definitions that the public health guidelines and the education guidelines have given us.
I would also chime in, Lisa. Oh, sorry, Jen, go ahead. Go ahead. Sorry.
Oh, no, I was just going to add, and I know we have several other questions. I was just going to add that ventilation matters. So air exchanges, airflow matters. I know that schools have taken steps to improve ventilation. Masks matter. And I just want to highlight something that Jessica said, which is we are going to be figuring this out. And so we're going to need schools, families to be with us and prepared to pivot if we need to.
And I would just add that is why we are emphasizing so much the concentric circles around kids in schools. That matters. Getting vaccinated, limiting your social interactions, making choices for the next several weeks to reduce risk is going to impact what we're seeing at school. So it is definitely an art and a science working with the schools to work through these very difficult operational issues. And it is not just that is going to determine what's happening. We all have a role to play. This is really a call to action for everyone in the community, but particularly people who have kids going to school. Like I mentioned, we can actively do things.
Thank you. Kelly from K2.
Good morning. Thank you for taking the time. I have two questions. I'll start with the first one. It's related to schools. This time last year, we were saying it was not safe for kids to be back in class, back in person. Obviously, case numbers are much higher right now than they were even last year. What's changed? There are a lot of parents out there who are very confused about that messaging. Can you explain a little bit about what the difference is this year?
I can start. Thanks, Kelly, for the question. I can start by saying a couple things. We've learned a lot about COVID. We are also now learning about the Delta variant. We also have learned that kids don't do well when they're not physically in school. So I think what you're seeing now is a commitment to getting our kids back in school using what we know about COVID prevention in schools and acknowledging that that guidance was developed before the emergence of the Delta variant. So we have tried to put in place as many precautions as we can. We're asking the community to do their part to slow the transmission outside of schools, which is a big factor in terms of risk to schools. And we are, like I just said, we are asking people to work with us as we head into this school year and be ready to change direction if we need to. Jessica, I saw you come off mute. Go ahead.
That, I don't think I would even add anything. That's perfect.
Okay, and then one other question, if you'll allow me. It's a little bit of a different note. So not kids in schools, but as we kind of start reopening again, a lot of businesses and companies and venues have started taking the stance of you have to be vaccinated, show proof of vaccination, or have been tested negative for COVID-19 in the last 2 days if you're going to enter. It brings up the conversation about other businesses making that decision and counties making that a rule that if you're going to eat in a restaurant, for example, that you have to show proof of vaccination. Is that something we're considering? And if so, kind of what's the holdup, if you will?
Yeah, I can take that. And that was a large topic on our briefing this morning with the county board. We are looking at that. We're not looking at it in isolation of where we are in this surge and where we're headed. It's certainly something that could factor in the coming months. We're working with the state actively on a technology solution. There are many different factors that go into this. Certainly there's the efficacy of where we're seeing transmission. So obviously wanting to cut down on anything happening within group gatherings, which is why we've put out updated guidelines recently, but there are some other questions that need to be looked at, in particular, the technology issues and creating a uniform platform that people can use. Different folks are doing different things right now. It's not one system. But then also looking at equity implications of what that means for different communities. So these are all things that we are actively asking questions to the community, to leaders, looking at technology and working with the state to figure out a comprehensive solution, and it's definitely on the table.
Thank you.
Julia Silverman from Portland Monthly.
Yes, thank you so much, everyone, for taking the time this morning. I have two questions, and I think they're for Dr. Vines. So last spring, when kids went back into hybrid, there were very clear metrics about what would be allowed for schools and when, and they came from the states, and they were tied to case counts and test positivity rates. I double checked this yesterday with the governor's office and the Oregon Department of Education, and there aren't statewide metrics this year for what level of school we should be at, whether we should go to CDL or hybrid. Instead, that responsibility lies with local public health agencies. If those metrics have been clearly enumerated, PPS or other local districts haven't communicated them to parents and families yet. So what are the metrics for when schools would need to return, either individual schools or district-wide, to hybrid or CDL?
Yeah, thanks. That's a great question. And I'll start by adding something to my last answer about what's different this time. And that is that we have vaccine. So we have kids 12 and over eligible for vaccination. We now have a mandate, in fact, from the state for teachers K through 12 to be vaccinated. So that is definitely working in our favor, even though no single precaution or intervention is going to be a guarantee. To the question of metrics and what would be our threshold for pivoting to a hybrid model or comprehensive distance learning, we get asked this question a lot. We don't have a hard and fast threshold. We're trying to support schools in balancing all of the benefits that come from having kids learning in person versus the risk of transmission of COVID-19 in schools. We have more of a framework, which is around trying to limit so build a school environment where you limit exposures, ideally. You limit disease, you limit exposures, and then limiting quarantines by having groups assigned to seats so that we can pinpoint and can quarantine only those kids who we really think have had an exposure as opposed to an entire classroom. So those are all strategies to keep kids in school. But if a school finds itself with an unacceptable level of transmission, too many people out, or just administratively not able to function, public health is going to be prepared to work on a case-by-case basis with those schools. Again, acknowledging to the first part of your question that this is now a county level and a school level, frankly, decision as opposed to a statewide framework. Jessica or Jamie, anything you would add?
I would just add to that, part of the equation that we always talk about too is, do you have the staff that can safely provide an appropriate and effective education for kids that can be there, right? So if you don't have enough bus drivers to get kids there safely because of a exposure event or something like that, then that certainly becomes a factor that the district and the LPHA would weigh into the decision making around that. Just as another data point.
And I guess I would just add back to Jamie's remarks about the partnership between public health and MESD regarding case investigation and contact tracing within the schools. That is why we have spent so much time building that out, is so that we can in real time understand as much as we can about what is happening. Because if something pivots, which it always does in COVID, we need to learn and adjust how we're approaching the situation in real time.
Okay, so that unacceptable level of transmission that Dr. Vines just defined, we don't have a hard and fast answer for what that would be, just to be clear. Okay, and my second question is kind of the opposite, really, which is at some point, this is going to get better. And I am wondering whether, I can understand why it wouldn't be your first priority right now, but I'm wondering whether Multnomah County Public Health can offer any sense to people about what specific metrics would need to, or targets would need to be hit before we can start rolling back some of these really thoughtful safety protocols so that kids can have something closer to a more normal school experience. Thank you.
Thanks for the question. It's true. So all pandemics end eventually. That said, the global state that we're in with viral transmission anywhere on the globe is going to potentially pose a threat to us here because it gives variants the opportunity to emerge. But to follow the optimistic thread, I would say, we caught a glimpse of that in late June, early July. When cases fell off steeply, a lot of people were vaccinated. People felt comfortable, traveling, socializing, because the risk of any of those encounters became very low. So when the overall community burden of virus is low, the risk of any interaction becomes much lower. And then, of course, the opposite is true. So I don't have a clear milepost for you, but I can say I don't see us in this mode forever. And Jessica, feel free to chime in.
Yeah, again, hopefully people got a chance to see the modeling information this morning on the briefing. If not, you can watch it online. But I think there's some hopeful projections going into September as we continue to see a high uptake of mask usage. So I know folks maybe don't hear all these messages all the time, but we're approaching what looks like 80% compliance with mask usage, which really matters. So, we might have some holdovers for some of these interventions like mask use for a prolonged period of time that really make a difference. So, it's looking at some of those milestones, including hospitalizations. I know we're going to be looking closely at analysis of any potential pediatric surge in the coming weeks to make sure we understand what some of that looks like. And then for me, I would say looking at those continued closing the gaps of vaccine uptake in BIPOC communities, that's going to be continuing to be an issue that we look at carefully in terms of how we move forward.
Thank you. Could we have Amelia Templeton from OPB?
Hi. I have a couple of questions. Is the biggest risk to schools remaining open staff getting sick at this point? Is that, or staff needing to quarantine because of exposures? That's just the first thing I'm wondering about.
I guess for me, I don't know that I would say it's the biggest risk. I think it's certainly one of the risks, and that is why there is the vaccination focus statewide for educators and staff. It's definitely a component, and I know that there was an article recently published that looked at a particular event, and Dr. Vines can probably talk about the specifics better than I can. But I want to go back to the connection between community transmission and school transmission, sort of on a meta level. What I see is that connection being of utmost importance, our continued understanding of what that connection looks like, and trying to make decisions based on understanding that, particularly for families that have kids in school. So Dr. Vines, I don't know if you want to build off of the MMWR article.
Yeah, I mean, we can certainly talk about the CDC outbreak publication if people are interested. I would say, to answer that question, I think teachers can actually be a firewall, to be honest. If they are vaccinated and they are good about masking and they are really good at reinforcing those precautions among their students, that's great. I think I probably worry more about families socializing a lot, kids coming into school, bringing infection from the community essentially into the school. We all know that kids are messy. So even the best laid plans around masking and assigned seating is going to be imperfect. And so again, families, everybody really limiting their socializing right now will only help.
Yeah. The other things I'm wondering about are just some specific questions related to the support that you're providing MESD. So is there sort of like a dedicated contact tracing or case investigation staff that's kind of working specifically with schools? What does that look like?
Yeah, thanks, Amelia. Certainly, we have had to again pivot, to use the popular term at this point in time, to reallocate staff to support schools in response. So in addition to our school nurses and health assistants out in the buildings that are part of our process, we have a dedicated team of 3 or 4 nurses that, depending on the time and depending on capacity, to help kind of respond and be the main points of contact with the public health department, so that we can provide that timely response and coordinate through the public health guidelines that we can provide out to families and staff as cases arise. So, and then of course, Dr. Vines or Jessica can talk about the staff at the health department that are supporting schools as well.
Yes, I mean, the answer is yes. We have a dedicated team that collaborates with MESD specifically to support any sort of school's response on the ground to understand what's happening. And I think I mentioned this before, but it's going to be particularly important for us to, like, day by day understand what's going on so that we can, to Jamie's favorite term, pivot if needed in our intervention strategy. So we have a team built out to do that.
In kind of response to both of your questions, Amelia, I think that school staff are going to be our greatest ally, right? So again, setting the example for students on the multiple layers of mitigation that everybody needs to do, as well as, again, being additional eyes and ears on the ground of what is really happening out there, and helping us identify and help us answer the questions of determining, how much of an exposure, how much of a potential exposure actually happened, and what our next steps may be.
Amelia, if you're good, we're going to move on to Drew Marine from KPTV.
Yeah, hi. Dr. Vines, you mentioned how much, the community plays an important role in this. And you mentioned you prefer that people didn't, socialize with people outside of their household this upcoming holiday weekend. But, some people might still do that. And how do you expect a spike post Labor Day weekend? And what is that going to look like for schools and the impact there?
Yeah, hi Drew, thanks for the question. We can look back and we can pretty much see an increase in cases following almost any holiday. with the exception, I think, last year of Thanksgiving. And so that's why we're here today. Thanksgiving 2020, in the weeks prior, we were seeing a steep increase in cases. People were indoors. It was the traditional respiratory season. Hospitals were stretched, starting to be stretched. And we asked people to pull back, and they did. And so that actually slowed that rise last year. So we know that when we ask explicitly and clearly, most people do the right thing. So I am hopeful that people will hear us now and understand that we have two goals around, again, hospitals and schools, two of our most important collective functions, if you will. But we are also needing to be prepared for an increase in cases that could spill over into schools, or simply schools themselves as daily gatherings. Even with the layered precautions that we have in place, we have to be prepared that school itself could start to drive cases, and again, be ready to change paths if we need to.
And just to follow up really quickly, considering again that the community is a reflection of what's happening in the schools, would you consider recommending capacity limits back in place at, restaurants and other things to help, limit that infection spread?
I think a single county acting alone on a policy like that, you burden businesses, and we think that you probably don't get much prevention out of that, and you end up spending a lot of time on the specifics of that policy when we're really looking for actions that can give us fast results, literally in the next days and weeks. And so again, everyone says everything is on the table, but speaking just for Multnomah County, we haven't felt like that was going to be a good use of time or our authority, frankly.
Okay, thank you.
Great. We're going to go to Courtney Vaughn from the Portland Tribune.
Hi, yeah, thank you. My question was similar sort of to Amelia's, I think. I'm just curious, what role, if any, does the county play in providing access to COVID testing for students and staff? I'm curious if a student feels like they may have been exposed, or a staff member feels like they may have been exposed and they become symptomatic, or even if they're notified they've been exposed, are there resources for them to get tested on site? Or will it be sort of incumbent on them to go get that done on their own time?
I can chime in a little bit on that. There's a couple, and again, on the briefing today, we covered this pretty extensively. There's two different avenues that schools can take around rapid testing and then surveillance testing that OHA, Oregon Health Authority, has stood up a system for, in which schools are individually engaging with OHA to engage in that process. I will say one of the most important roles that we've played throughout the entire pandemic is very quickly standing up low barrier community-based testing, which we have maintained and we're actually expanding. Today, we expanded our testing site at the Fabric Depot, and we will be adding that Tuesday, to our community-based testing site to help bolster that need in the community, and we're looking at additional capacity. My understanding is that other community partners are also looking at reestablishing community-based testing sites to, again, establish what we call low barrier testing. So I think that gets at your question around, something happens and people quickly need to respond. So I think it's, again, one of those situations that's incumbent upon multiple systems to engage in. Certainly schools are doing that, but we need to do it as well to make sure those resources are out there for folks.
Yeah, and I would just add to the all but one of the student health centers are reopening for this year. Last year, of course, just because of the situation, only a few of them remained open. So that'll still be an access point for testing and COVID vaccine for students across the county.
Thank you. And can anyone elaborate? Is there rapid testing available, or I know sometimes that testing takes up to 72 hours to get results. So is there sort of a protocol on, if a student or staff member goes to get tested, are they required to quarantine in the meantime, or is it just sort of, once you get the results and know that way?
Yeah, I can talk a little bit about the diagnostic testing at school, if that's okay. The OHA program specifically for schools is for symptomatic individuals that develop symptoms while they're on site. So obviously we don't want symptomatic individuals coming to school because we want them to stay home and seek testing in the community. But almost all of our schools, at least at the middle and high school level across the county, have access to the Binax Now test, which is the quick acting 15-minute result test. Anybody that is tested must then go home and wait for further direction on when they can return. But that test is readily available through the OHA program for symptomatic students and staff while on site, which is different from the screening testing, but the symptomatic testing is, I believe all of the PPS districts have the symptomatic testing available, and all of our other districts at least have it at the middle and high school level. And that has been in place since last spring when the county hit the certain metrics that somebody referred to earlier that triggered that requirement. And all of our districts have continued that, at least at the levels they were doing it.
Thank you.
Great, Courtney. I'm going to move on to Ashley from KGW. Ashley Corsley.
Yes, thank you guys for taking the time to chat today. My question actually piggybacks a little bit off of Courtney's question. Can you just elaborate or reiterate the protocol when it comes to a positive COVID test, either in a student or a staff member at a school? What happens at that point when it comes to, isolating the rest of the classroom or making the kids stay home? I guess I'm looking at this from the perspective of what do parents, especially parents who struggle with childcare or have work obligations, when it comes to having to keep their kids out of school on a possibly pretty regular basis if the cases start to spike once school begins?
So our process, Ashley, is to, as soon as we become aware of that positive case, or if somebody even reports that they have been in close contact, we have a process to gather as much information up front as we can. And then the MESD communicable disease team reviews that information and makes some determinations whether there was close contact at school and whether there was potential exposure to other individuals. Based on that information, then in collaboration with public health, county public health, we provide the appropriate timelines for that individual. And then if there was a potential exposure to other individuals on site, then we provide the appropriate timelines and communications for those individuals as well. And then for full transparency, there is typically a community notification that is sent if there is a potential exposure. There is a community notification that is sent to all the individuals that are associated with that school or that school site to let them know that a positive case has been identified, lets them know what steps are being taken to maintain the safety of that school community, and letting them know what the next steps are.
Ashley, are you good?
Oh, yes, thank you.
Good, good, good. Erin Ross, OPB.
Hi, I wanted to follow up a little bit on Courtney's questions about in-school vaccinations. So it sounds like there isn't any like mandatory screening or like weekly testing or anything like that required for students or teachers. Is that correct?
There are for testing or for vaccination?
Testing, sorry, testing.
There's the two programs, and we can share with Julie so she can share out the OHA program information so folks can look at how that rolls out. But they're not mandatory engagement processes for the schools. Jamie, I don't know if there's anything you would add.
Yeah, again, the symptomatic testing is something that everybody's doing. The asymptomatic or the screening testing is not a required item, but certainly districts are looking at that and determining whether logistically it can fit into their routines and their daily schedules. And so, trying to overcome some of those barriers. One of the OHA programs is a mail home kit for school staff that they can actually mail into a lab. And so that program, I think, has been available since the spring. And then I think everybody is still trying to find out additional information from the Oregon Health Authority on the student option for screening, whether that's weekly or on some other schedule. I think there's still information to be gathered. And then again, making determinations of how that logistically fits into the school day.
And just, do you know if like they're considering doing like pool screening, for example, to try and like ease that? Because that's obviously a lot of kids to test if they do that. Or are we still pretty much just up in the air on info on that?
I think everything I've heard so far is maybe choosing a certain grade to do on a certain day. But again, that's just kind of early information and still gathering information on that.
And then what sort of impact do you think that regular testing would have both on reducing transmission in schools, but also on the likelihood of like students needing to quarantine?
So I'll just comment that kind of, it's called surveillance testing, but it's that kind of preventive testing, like sampling testing, looking for cases before people have symptoms. That is an effective strategy. You have to test a lot of people pretty frequently to really get the best prevention effects. I think this has been a question of what the State Oregon Department of Education has required versus what schools are actually able to do. But yes, it does have a role in prevention when done intensely.
Thank you.
Lisa Balick has a follow-up. Lisa, do you just want to go ahead and ask your questions about quarantine and kids wearing masks, et cetera?
Yeah, sorry, I just had to send it in there. In other words, I thought there is no quarantining if kids are all wearing masks, if there is somebody who's identified, a student identified with COVID.
So Dr. Vines might be able to talk about this a little bit more, but in general, yes, you are correct. So there is an exception that the resiliency framework out of the Oregon Department of Education has allowed for if the school can attest that everyone in the classroom was maintaining at least 3 feet of distance and appropriately masked through the entire time that positive individual may have been there, then, and this only applies to students, does not apply to other staff or adults that may be in the classroom as well, that we may not have to quarantine that cohort or that classroom because of because of that exception within the guidance. And again, that's only in the classroom setting. That would not apply to the lunchroom. It may apply to the bus. It just kind of depends on the situation and what kind of capacity the bus has as well. But Dr. Vines might be able to add to that.
Thanks, Jamie. I don't have much to add. That is my understanding on paper. I would use this question to say that we're going to be learning not just locally from our direct experience, but there's going to be national learning as many other school districts go back to school with masks, without masks, all different versions. We're going to be learning what works and what doesn't. So again, that is correct as far as avoiding quarantine if the school can attest that kids were 3 feet apart and masked. But again, we have to expect that our understanding of Delta transmission in schools in particular is going to change with time.
And for parents understanding the 3 feet meaning nose to nose, not desk to desk, correct?
Correct.
All right, we have time for one more question if anybody has. Otherwise, I think we've covered the gamut here. While people are thinking, there's 3 things that we can share with you today. There were some state and OHSU folks who came and did some modeling discussion with the Board of Commissioners. I put our link to the board meeting in the chat. It's worth looking at. There's a lot of statistics and definitely saying where they think Delta is going next. And if you go to our COVID-19 website or just Google Multnomah County COVID and gatherings, there's a really good fact sheet. It's in multiple languages on sort of sort of just practical advice for Labor Day weekend, if you want to share that with your viewers or readers. Otherwise, I'm going to take one last shot. Looks like everybody has gotten through everybody's questions. So I again want to thank especially our partners from Multnomah Education Service District, Dr. Vines and Jessica Guernsey, and all of you reporters who many of you have kids who are heading back next week or tomorrow and this week. And that's how important all of this discussion is. So thanks to everybody. If somebody needs a recording or a question you want to follow up, shoot me an email and a text or Ryan Yambra, and we'll get back to you. And just want to thank everybody who's here today. Thanks so much. Stay safe. Bye-bye.